spike in sugar, the vitamins and the minerals are flushed out. I already mentioned that there is a lot of nutrient wastage. So whenever there's a spike in sugar, all the B group vitamins are lost, which are actually needed for the insulin sensitivity. Whenever there is a spike in sugar, we lose on vitamins like C and D3, and these are the vitamins which are needed for immunity. So when we are losing these kind of vitamins, then we are also losing our body strength and immunity. Again, the minerals which are needed for the production of insulin to maintain the insulin sensitivity, like zinc, selenium, chromium, iron, all of them are getting depleted because of the nutrient wastage. Whenever there's a sugar spike, there are also a depletion of electrolytes like potassium, sodium, magnesium, calcium. All these are also lost. And that is the reason that we experience cramps. So to keep these vitamins, minerals, and electrolytes in place, we do need supplements. But the major thing that we need to remember is that supplements work only when we make sure that we sleep well, we eat good, and we make sure to work out also. Only when the base diet is good, then the supplements work. Just popping in supplements is not going to help us if the other things are not addressed. Here I present some superfoods, which are excellent sources of all the vitamins and minerals which we just spoke about as supplements. Omega-3, minerals, vitamins, essential fats, fibers, all of them are found in these foods. When I talk about them, these are a few of them which should be there in a diabetic food plan. First thing, tubers. When I say tubers, these are root vegetables, and they're mostly shunned because they are believed to be starchy. And with the fear of getting more starch, more carbohydrates, generally we stay away from the tubers. But tubers like sweet potatoes, the name itself kind of, scares a diabetic person. Oh, it is sweet. How can I eat it? But sweet potatoes are one of the rich sources of vitamin A, which is all the carotenoids, which is great for our immunity, for our eye health. To boost the energy level, it is the sweet potatoes which work so well for us. And the vitamin A present in that helps fight infections and prevents bloating, acidity, constipation, the fibers present in it. Acidity also flushes out all the minerals. So if a person who's diabetic is facing acidity or constipation, that needs to be addressed also. So what I'm trying to say here is that it is the entire body which has to be taken into picture, and diabetes cannot be treated as a separate entity. Similarly, these other foods like fenugreek, Sri Lankan cinnamon, they all have functional elements which help reduce, the insulin resistance and help produce good amount of insulin in the body. So we need to make sure that they come in the food plan. Again, there is a very strong, I would call it a myth that everybody believes that soaking the fenugreek seeds and drinking the water in the morning helps us. But actually, that's not the right way of taking it. The right way of taking the fenugreek seeds is adding it to your vegetables, sprouting it and adding it to your salads, and eat it, and even putting it in your tadkas and eating it with the right kind of fats, herbs, and spices. That is when the functional element actually functions properly. All the seasonal fruits. The seasonal fruits are again looked down because they are sugary, because they're not considered exotic, but the local seasonal fruits are the exotic fruits. And they are the ones which are a treasure trove of minerals and vitamins and antioxidants, a huge source of antioxidants, so helps fight the inflammation also. So we should look into the season and pick the fruit which is very local to the area where we stay, grown around us, produced in that season is the fruit that we should be picking up. Seeds are again good source of omega-3. we should be looking into flax seeds, sunflower seeds, pumpkin seeds, all great sources of minerals. Again, the garden cress seeds, these are great source of vitamin B, iron, folic acid, omega-3. All the seeds are providing us these in the right quantities. So we should be adding it to our food plan. The gooseberry or the amla is the best berry of our nation. When we talk about diabetes in our nation, we should make sure that we add amla every single day in our food plan. It can be added in many different ways. There are ways to cook it and have it as in chutneys and in pickles. And also we can take amla juices. So this is one rich source of chromium and again a great source of vitamin C. Bitter gourd, good source of A and C. Turmeric, again we get lots of curcumin, which is anti-inflammatory. From garlic, we're getting the allicin, which is helping us reduce the cholesterol and stabilize the blood sugars. The curry leaves, wonderful source to secrete enzymes, which aids in proper digestion, which helps stabilize the blood sugar. So these are some kind of foods. There are many, of course, but these are some which we should definitely look into for a food plan for a diabetic person.